Welcome back. Let's turn our focus here now. The IFP says as much as it supports the universal access to healthcare, it does not support the government's current and much touted national health insurance. Its National Parliamentary Caucus has been hosting a health and welfare summit in Johannesburg to discuss the NHI with various health experts. Last month, the IFP did not support the adoption of the NHI Bill in Parliament. Now, let's discuss this further. We're now joined by Narend Singh, IFP Chief Whip. Thank you so much for your time this afternoon, Mr. Singh. Parliament passed the National Health Insurance Bill, as we heard, despite your reservations. Let's now talk about the two-day Health and Welfare Summit you are holding. You know, what is it about and what are some of the outcomes of that summit? Just very briefly.
Thank you very much, Onaje, and thank you to your viewers. Yeah, very briefly, as you said, the NHI was passed by the National Assembly and the IFP did not support its passage, although we support universal health care. And the reason is that we have serious concerns about the governance of the NHI moving forward. Firstly, we believe that having one single user pay system managed by government and all our taxpayers' money going into that kitty, we know what history government has in terms of managing funds. We've seen failed state-owned enterprises. We've seen billions of rand being poured into state-owned enterprises, and we just have to name, your viewers would know SAA, Eskom, Denel, etc. So we were pleased that we were able to put together as a parliamentary caucus renowned speakers and panelists from the South African Medical Association, from government itself, Dr. Nicholas Crisp, from the Funders Association. We had Dr. Anushka Kuvadia, who is an expert on health issues and has worked in 40 countries around the world. We've had the Institute of Race Relations and another gentleman, Mr. Michael Sitas, who's an economist in terms of health issues. And I think after listening to all of them, we find that the decision we took was an appropriate one. And we will now have the opportunity, having been informed by all these inputs, to make appropriate amendments or propose amendments when the bill goes before the National Council of Provinces.
Now, with all that you've said, we know, of course, that the bill still has a long way to go before it's made into law. But the reality is that the current state of our healthcare system is just one of the reasons that perhaps the World Bank report, affirming that South Africa is one of the most unequal societies in the world. What then will it take for us to ensure a world-class health system that is accessible to all?
I think just in two words, political will. If we have the political will to care about the health care professionals that are within the public service, the doctors, the nurses, and everybody else, the ambulance drivers, and everybody else involved in the healthcare services. If we have the will to ensure that our infrastructure is appropriate for conducive healthcare to be provided to people, if we have the will to ensure that we don't have babies being put into cardboard boxes, if we have the will to ensure that we don't have professionals working 24 and 36 hours a day, if we have the will to ensure that we employ all doctors who are capable of being employed within the sector, because right as I speak at this moment, and even today, we were getting calls from young people that have completed their board exams, a community service, who are without jobs. They've graduated, they're without jobs. And this is not only people from South Africa who've graduated here, but people who, through no fault of their own, have had to graduate abroad, come here, complete the exams, and they are sitting at home having completed 8 or 9 years of studying without a job. And yet we hear about the healthcare system. We don't have enough doctors. We are losing a number of our healthcare professionals to countries around the world. So we've got the best that the world can provide, but we are not creating a conducive environment for them to be employed in the public healthcare sector. And this is why, Onati, there is a fear that if government cannot get the public healthcare sector right, cannot get primary healthcare right in our country, then, could we place this NHI in their hands for them not to even consider working with the private sector in partnership? These are our concerns.
Many agree with you, Mr. Singh. I'm not sure if you're still with us. Do you still hear me? Oh, there you are. Many agree with you, to say that the health infrastructure. The NHI, in an ideal world would be working perfectly. It's just that we don't have a conducive environment for it to be implemented now. But say it is passed into law. How then do we ensure that it is corruption-free, as you say, as we saw, of course, during COVID-19, that in terms of administration and funding, that everything is above board? I mean, at the moment, it's not really clear even how much it will cost, the country every year. Some are talking about it being up to the tune of 500 billion rand a year.
Yes, so what we need to put into the legislation is checks and balances. And although we can have checks and balances, and we've seen how far we've gone when we listen to the report of the Zondo Commission, but we have to have appropriate checks and balances, not only that government is going to police themselves, and we ask Parliament and portfolio committees to police the minister. We've had to have the Auditor General come in on a special operation to look at the COVID funds and how they were being spent, and not even that during the flood times. So, I mean, these are lessons. Experience is the best teacher, and these are not good lessons that we've learned. So I think you're very correct that we still don't know. There's a lot of uncertainty about the passage. We know we want to travel from Johannesburg to Cape Town. We know where we're going to stop for the first 2 stops, but after that, the South African public at large are unaware of what's going to happen. I mean, even if we talk about providing healthcare in a rural area, which people don't access very easily, how will they access? What kind of administrative systems are we going to put into place? We don't want to see this, being passed as legislation a few months or maybe a year before the national elections, and then it's something forgotten about. Because we've had promises from 1994, we have continued promises, but by and large, there's service delivery from the side of government, unless they partner with the private sector and the public, on the whole question of health care, they're not going to be able to do it on their own.
I mean, some would, as we wrap this conversation, some would say that as a party, you say you support universal access to healthcare, but it would seem as though you are blocking this initiative, especially something that could see, the poor people in South Africa that have for a very long time not have been given adequate access to healthcare, not being given that access, and yet you are not putting tangible solutions on the table. What would you say to that?
Well, there's a simple answer to that. You don't need the NHI to provide quality healthcare to the people. Hundreds and hundreds of millions of rand are appropriated each year to national department, to provincial departments, and to municipalities to be able to run primary healthcare facilities. So this is not the question about healthcare not being provided to the people. We're not blocking, but what we are saying is tell us what you aim to do with NHI. Do what you are supposed to do and do it right. As one of the presenters told us, a professional, it's like having the best cell phone that you could buy, but there's no network in the area where you want to use a cell phone. That's what it's like. We want to have the best system, but we don't know how that system is going to operate. And then we think that government and the minister have to be more transparent in the way they talk about NHI and how it will affect ordinary citizens. I mean, there was a question asked by some of our panelists yesterday. We have hundreds of thousands, if not millions of people who are undocumented in our country that come through our borders. Some of them are asylum seekers, some of them have registered documents, but there are many without any kind of documentation. In fact, we were told there are about 1.8 million that they discovered during the time of COVID that didn't have proper documents. How are we going to care for them? So whilst we need to make the weak stronger, we must not at the same time try and bring the strong down to make them weaker. We need to have equal access, quality healthcare for all the citizens, and that's what we are saying. But it must be within a properly regulated framework that we need to agree on as the private sector. At the moment, Unati, there are medical practitioners who really don't know what the future is going to be. And we rely on these 12,000 doctors that belong to SAMA. They don't know how this is going to affect them. So let's have more certainty. And I think we've got the opportunity now, as we move the bill from the NA to the NCOP, there will be public consultation, but government must have an open mind on this. And one of the speakers told us it's ideology versus vested interests. And we need to move away from that. We need to make it what is good for the people of this country. And it will work if we can provide quality healthcare.
Mr. Singh, thank you so much for your time this afternoon. Really do appreciate it. And of course, that was Narend Singh, IFP Chief Whip.